they have opinion, and they many times will tell you, oh, I never heard about this, it's not going to work for you, which is absolutely not true, because these people are ignorant, they don't know much, and they have opinion. Somebody who is expert, who studied this, who has experience with many thousands of legs being treated, will give you an answer. Physicians who published on the subject and who are well prepared to answer your question. Can we promise you that your leg will be saved? Nobody can promise, but it is the best shot that you have of saving. Of course, you don't have to wait until the leg comes to the point where you need amputation. The circulator boot can help at any stages of wound development. Okay, the circulator boot, or also known as end-diastolic pneumatic compression, is a system of equipment which is delivering blood flow and improves the blood flow to the lower extremities. It brings oxygenated blood to the areas which are deprived of oxygen. It is composed of the hard casing, which is we call it a boot, the plastic bag, which is the patient's leg is wrapped into this and placed in a boot. It has a timing device. It is also has a heart monitor, and heart monitor is connected with the timing device and air compressor. What happens is the patient's leg is placed inside the plastic bag. The air is delivered into the plastic bag by the air compressor and is gently squeezing the leg, causing the compression of the portion of the leg. This is timed by the special valve assembly, and valve assembly is connected to the patient's heart and is regulated by the patient's heart rhythm. The compressions happen in the end diastole, or during the phase when the heart is relaxing, at the end of relaxation phase. Then quickly the pressure is released and the bag is deflated just before the heart is contracting in a systole. By repeated compression on the leg, we bring more blood into the area which is not receiving blood. And let's say the areas may be occluded or partially occluded. We feel it's like washing a dirty sponge, where water is supplied many times and eventually the sponge gets clean. We feel the same thing happens with circulator boot. It helps to wash out the debris of blood clots, the cholesterol, the calcium deposits, and helps to stretch a little bit the arteries so there's improved blood flow to the area. The circulator boot is improving function of the heart itself. The wave of the blood in a early diastole helps to increase the flow of the blood towards the heart and makes the filling pressure of the heart higher. At the same time, when it's deflating in systole, it helps to reduce the blood pressure in the aorta, and heart is contracting against the lower pressure. This way we can improve function of the heart in a way that the heart is pumping with a larger volume at a lower pressure, and the patient's heart is benefiting by resting and not working as hard as normally it would. We can compare this to intra-aortic balloon pump, which is the same general principle, and the difference is we are having a non-invasive approach, much easier to apply, no need for surgery. The patient's heart is benefiting from this. It was approved by FDA in the past. We need more research to introduce this to a treatment of the patients at this time. Patients who have a non-healing arterial, venous, lymphatic, or other leg ulcers or foot ulcers, the patients who are not responding to the usual treatment, vascular revascularization, the surgical treatment, bypass, stent, or angioplasty. Also the patients who have a connective tissue disorder, patients like with a scleroderma, with dermatomyositis, with different other conditions, with Raynaud disease and so on. These patients many times develop leg ulcers or hand ulcers. They look fingers and toes, sometimes entire extremity due to a poor blood flow. From our experience, we had several patients who benefited from this treatment. Of course, patients who have atherosclerosis, who have a high cholesterol, they develop blockages, plaques in the arteries, and they are at the risk of losing the leg. We found that this is beneficial and is approved by Medicare for this particular reason. Who is excluded from a treatment? There's only one contraindication, and it is deep vein thrombosis, the blood clot in a large arteries, in a large veins inside the leg. These patients are at the risk of dislodging the clot, which by pumping can travel to the lungs and occasionally even kill the patient. We treat these patients, however, with heparin or other means, and once they are stable, they can use circulator boot. So it's only a temporary problem. There's no other contraindication to treatment. It's a safe, non-invasive treatment. Patients are usually sitting comfortable in a chair or bed. They can read a book, watch television, or even take a nap. Many times they can bring maybe iPod or some other player and listen to the music. So the insurance, including Medicare, cover the treatment. Usually we need to make sure that each patient has a certain conditions which meet the insurance requirements. It is published on Medicare website, and everybody can see this. The length of treatment. We treat patients daily, usually Monday to Friday or Monday to Saturday, 1 hour a day, and typical length of treatment is about 30 to 35 treatments. This is enough to substantially improve the blood flow to the leg. The patients who have leg ulcers, they start healing with improvement in the skin color, temperature, in a healing of the inflammatory changes. The patients who have infection, they benefit because the antibiotics are more effective when there's more oxygen coming to the wound. As far as the percentage of successful treatments, from the patients who are approved for treatment, which we feel that the patient definitely will benefit, this about 93% of patients totally recover. Some of the patients improve to the point that they can finish their treatment at home with the usual means of debridement, local care, and so on. What are the causes of failure of treatment? Usually uncooperated patient who comes only from time to time or fails to come, the patients who don't follow the instructions, don't take their medications, and so on. As far as other reasons, the patients need the transportation to our center, or they need to stay close by. We have a number of hotels and other places that the patient can be staying for the course of a treatment when they come from a long distance, and we have visitors coming from other countries, from Canada, from England, from Saudi Arabia. They usually stay in a hotel and they have to arrange their own transportation. Many patients are sick enough that they have to stay at the nursing home, and local nursing home provided transportation at their cost covered by insurance.